If you have a meniscus tear that won't let your knee flex or extend, what options are possible to restore knee motion? I discuss a locked knee in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video, like all of my videos the last 5 or 6 months, this is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Okay, fairly simple question. This time it comes from viewer at Brenda Green 1. I'm going for surgery soon. I have a meniscus tear that's flipped over on itself and I can't bend or straighten my knee. Does you have any issue with that, and what is the prognosis or result? Okay, before I answer Brenda's question, just to understand, not just Brenda, but everybody who's watching, just understand in this video, like all my videos, I'm not giving medical advice. This is meant for general information and educational purposes only. Okay, a meniscus tear, I've done a lot of videos on meniscus tears, C-shaped shock absorber on either side of the knee, medial side, lateral side of the knee. And what can happen sometimes is a part of it tears and it flips into the center of the knee, basically blocking motion. You can't bend it back. You can't straight forward. It tends to be stuck in a certain position, usually with the knee bent a fair amount, and you can't get it all the way straight and can't get it all the way bent. There, unfortunately, is no way to necessarily unlock the knee to get that part of the meniscus out short of surgery, where a sports medicine orthopedic surgeon goes in arthroscopically through a couple of poke holes, looks with a camera, and uses an instrument to push it back into place. So yes, that's unfortunate. It very often needs surgery. But what happens, the potentially good news with that is that very often that's a specific type of meniscus tear called a bucket handle meniscus tear, which very, very often can be sewn back together with stitches. Now, it's a long recovery, and I've talked about this in other videos, maybe 4 to 6 months, because you have to protect the repair, limit weight bearing, limit motion to a certain extent while that meniscus heals. But assuming it does heal, if it does heal, the good thing about that is you preserve that entire meniscus and greatly, greatly, greatly decrease the risk of future osteoarthritis. But as far as her question in terms of what are the options, it is surgery to go in and basically get the meniscus unflipped, not blocking motion anymore, and then hopefully to repair it. Very good long-term outcomes, assuming it heals, but it is a long recovery, just so you know that. If you want a copy of my ebook, The Arthritis Solution, you can get that free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than steroid injections, click the link in the description under this video, fill out the contact form, and you can learn more about scheduling an appointment to see me. Also, I'd love to hear your experience with your injury, meniscus tear or otherwise. Leave those in the comments below. Now, just understand, if you leave a question for me in those comments, I can't offer you medical advice. But what I do a lot of times, like I did here, is I might answer your question in a future video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video or when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.